Okay, so this is a story about burnout in some really high-stakes jobs. And the solution, believe it or not, comes from a very unexpected place, one of the most advanced machines ever built. So take a look at this. This is the F-35 fighter jet. It's just packed with insane technology, cutting-edge sensors, stealth, incredible engines. But the real secret to its success, it isn't what you might think.
Yep, the pilot. The true genius of this machine isn't the hardware. It's that the entire system was built from the ground up to support the human inside. The data displays, the controls, everything, it was all designed to boost the pilot's abilities and reduce their mental workload. It turns them from just an operator into a real tactician.
So what in the world does this have to do with healthcare? Well, it turns out a lot. This same exact idea of human-centered design is now being used to tackle a crisis in a totally different high-stakes environment. Because when a system puts too much strain on the person at its center, things start to fall apart. It doesn't matter if you're at 30,000 feet or in an operating room.
We're talking about clinician burnout in military healthcare. And let's be clear, this isn't some personal failing. It's a system design failure. Just look at that spaghetti diagram on the right. It perfectly shows the chaotic, inefficient maze that clinicians have to navigate every day. It's a system practically designed for exhaustion and error.
And this quote really hits the nail on the head. When we only focus on making a process faster, we often just shift the burden onto our most valuable asset, our people. We try to speed up the system, but we actually end up making their jobs harder, creating a system that's working against them.
All right, so let's dig into why this happens. It kind of comes down to two big ideas, two powerful methodologies that are at the heart of this challenge. On their own, they're great, but when they don't work together, they can actually make the problem even worse. So first up, you've got Lean Six Sigma, or LSS. This is a super powerful engine for making things more efficient. Think of it as this amazing toolkit for mapping out every single step of a process to hunt down and get rid of bottlenecks and waste. It's fantastic at that, which is why the Defense Health Agency uses it so much.
Then, on the other side of the coin, you have something called Human Systems Integration, or HSI. This is all about designing systems that work with our human limits, not against them. HSI asks the really important questions, like, is this tool actually easy to use? Is this workload even sustainable? Is the layout of this room causing physical strain?
So here's the disconnect, right? These two approaches are often seen as totally separate things. But Commander Vince de Guzman proposed a brilliant way to bring them together. He realized you just can't optimize a system for pure efficiency without also optimizing it for the humans who have to run it.
In this diagram, this is the breakthrough. It shows the solution so clearly. You make human performance a non-negotiable requirement for any process improvement. So instead of being an afterthought, HSI, with its focus on people, training, and human factors, becomes the absolute core that everything else revolves around.
And what this does is create a brand new, upgraded framework for improvement that protects both the process and the people. It takes the proven DMAIC structure from Lean Six Sigma. That's define, measure, analyze, improve, and control. And it injects it with a human-centered perspective at every single step. Okay, so let's walk through how this 5-step process actually works with this new HSI lens. This is where the theory gets real and becomes a practical tool for making change. So, first you define the problem, and you measure the baselines. But now, you're explicitly including the human cost. You're not just measuring patient wait times anymore, you're also measuring things like clinician fatigue levels and their cognitive load.
Next, in the analyze phase, you basically become a detective. You're hunting for the source of that human-system mismatch. Why is this specific task so mentally draining? Where's the technology creating more confusion instead of clarity?
And you use tools like this fishbone diagram to do it. It forces teams to look beyond the simple, obvious answers and really consider how all these different factors, the people, the methods, the machines, the materials, the environment, all contribute to the problem. Then you get to the good part. You improve the system with human-centered solutions, like better software interfaces or more ergonomic workstations. And this is critical. You use control measures to make sure those improvements actually stick, preventing the system from slowly sliding back into overload. This ensures that the improvements for people are just as permanent as the improvements for the process. If you see human performance metrics like workload or job satisfaction start trending in the wrong direction, you know you have to step in before burnout takes hold again. So, why does all this matter?
What's the real-world impact of a framework like this? Well, it's about way more than just making clinicians happier. It's about making the entire healthcare system stronger and safer for everyone.
The results are pretty huge. You get less burnout, for sure. That leads to fewer errors, which means better patient care, and at the end of the day, a more resilient and ready military health system. When clinicians are supported by the system, they can provide better care, and that boosts the overall readiness of the force.
And that, believe it or not, brings us full circle, right back to our pilot. The lessons we learned from designing this incredibly complex aircraft have direct applications in our hospitals and clinics.
And here's the key takeaway. Designing around the human operator isn't just a nice idea. It's a strategic necessity. It's what allows for peak performance in the most demanding situations, ensuring both safety and mission success.
This is really the core principle that could transform not just military healthcare, but any complex system. We have to stop trying to force people to adapt to poorly designed processes and start designing processes that adapt to people.
It's such a powerful question, isn't it? It challenges us to really rethink how we build the systems we all depend on. The technology is there, the methodology is there, now it's just about making the human the priority.